Hello, my name is Lindsey Wolz. I'm a registered nurse in Florida. The topic I am going to discuss today is a urinary tract infection. So, a urinary tract infection, or a UTI, is an infection in any part of the urinary system. The urinary system includes the kidneys, ureters, bladder, and urethra. Most infections involve the lower urinary tract, which is the bladder and the urethra. The objective of this presentation is to explore urinary tract infections, including the impact on the population, etiology and risk factors, pathophysiology, clinical manifestations and complications, treatment, and nursing evidence-based practice. The impact on the U.S. population. UTIs are one of the most common bacterial infections in the U.S., particularly affecting women. UTIs affect millions of individuals annually in the U.S., with women being at increased risk due to the anatomical and hormonal factors. It's estimated that nearly 50 to 60% of women will experience at least one UTI in their lifetime, and approximately 20 to 30% will suffer from recurrent UTIs, which is having 2 or more infections within 6 months or 3 or more within a year. While rarely life-threatening, UTI can cause significant discomfort and disruption to daily life. Recurrent UTIs further exacerbate morbidity, leading to chronic symptoms, increased healthcare visits, repeated antibiotic courses, and the considerable impact on the patient's quality of life and mental health due to anxiety and frustration associated with recurrent episodes. Mortality from UTI is rare. However, if left untreated or they progress to complicated UTIs, there are serious, severe consequences, like a kidney infection, which can lead to sepsis and potentially death. This is particularly in vulnerable populations such as the elderly. The economically UTI has direct costs attributed to healthcare visits, diagnostic tests, and antibiotic treatments. The estimated annual cost for treating UTIs in the U.S. is approximately $2 billion. Recurrent UTIs significantly contributes to this financial burden due to repeated healthcare visits, lab tests, and long-term treatment plans, which often include prophylactic antibiotics. UTIs are the leading cause of outpatient visits and antibiotic prescription in the U.S. The frequent need for medical consultations, urinalysis, and culture tests, along with the recurrent nature of the infection, places a heavy demand on healthcare resources. The rise of antimicrobial resistance can complicate the management of UTI. This resistance leads to higher treatment failures, necessitating the use of broader spectrum antibiotics or combination therapies, which is more expensive and may have more adverse effects. The etiology and risk factors. The cause of UTI is when bacteria moves from the perineum or rectum to the periurethral area and ascends into the bladder. Figure 1, which is from Mayo Clinic, that is a visual that illustrates how the bacteria moves from the skin or rectum up the urethra into the bladder, which causes the infection. E. coli is the most common bacteria that causes UTIs. Some common risk factors include the insertion and the continuation of indwelling catheters. That includes those in the hospital or those who have them chronically. Incomplete bladder emptying, poor hygiene, sexual intercourse, especially those with multiple partners, dehydration, diarrhea, and being a female are all risk factors. The pathophysiology. Colonization is when bacteria from the fecal flora colonize the periurethral area, and vaginal enteritis. The ascension, pathogens travel up the urethra into the bladder. This is the primary route, particularly in women due to shorter urethras. Adhesion, uropathogenic bacteria like E. coli use surface structures to adhere to the bladder mucosal wall, preventing it from being washed out by urine. invasion and inflammation. Once attached, bacteria multiply and invade the bladder cells, triggering a host inflammatory response known as cystitis. If left untreated, it can ascend into the ureters, then into the kidneys, which is pyelonephritis. Figure 2 is a visual to show the pathogenesis of a UTI. Clinical manifestations and complications. Common clinical manifestations include pain or burning with urination, frequent urination, the constant feeling of needing to empty the bladder, bloody urine, and suprapubic pressure or cramping. In the elderly, a UTI can manifest differently with altered mental status. Symptoms with an untreated UTI or complications of a UTI include fever, chills, lower back or flank pain, nausea, vomiting. An untreated or complicated UTI can be potentially dangerous in elderly or those who are immunocompromised. The treatment for UTI can be as simple as prescribed antibiotics from a provider and plenty of fluids and rest. It can take time for the symptoms to resolve. It's important for nurses to educate patients and families on how to take the antibiotics properly and how to prevent them from reoccurring. Nursing evidence-based practice. A CAUTI is a catheter-associated urinary tract infection. Since having a Foley catheter is one of the main risk factors of getting a UTI, the evidence-based nursing practice I chose was how to prevent a CAUTI. The CDC recommends that all healthcare facilities only use urinary catheters when needed, and place catheters using proper germ-free techniques with sterile equipment, maintain the catheter's closed sterile drainage system, remove catheters as soon as a patient no longer needs them, since prolonged use is the most important risk factor for CAUTIs. Healthcare facilities should follow the 2009 CDC guideline for prevention of catheter-associated urinary tract infections. The guideline emphasizes the proper use, insertion, and maintenance of urinary catheters in different healthcare settings. Nurses have a huge role in preventing CAUTIs. Nurses are mainly the ones taking care of the catheters in the hospital, so we can take charge on this issue. We know when a Foley should be inserted or removed and how to keep it clean to keep patients from getting a urinary tract infection. We are also the main ones educating patients on how to prevent them, so nurses are a big role in that. The remaining slides provide the sources of information used for this video. Thank you for listening.